So just so you know, the opinions expressed in this webinar series are those of the presenters and do not necessarily reflect those of N.A.P.S. And we thank you for your participation. So just a little bit about the National Association of Peer Supporters. We're a trade organization for the peer support profession, and members include peer specialists, supervisors, and allies. And our mission is to grow the peer support profession by promoting the inclusion of peer specialists throughout the healthcare and other community systems. Just a little bit about the Q&A and certificates. We ask that you hold your questions until after the presentation. There will be a Q&A session at the end of the webinar, so I'll be looking through the chat and sending those questions to our presenters. Also, if you are a member of N.A.P.S, you can email membership@inaps.org. So I'll put that email in the chat as well. And you can request the link to the quiz as well as your certificate for the webinar. Without further ado, I will turn it over to Rosemary and Vince to present. Oh, and one final note, please just make sure to mute yourself if you aren't speaking. That just helps make sure that the presenters can be heard. Thanks so much.
Let me make this large. There we go. Well, good morning or midday, wherever you are. I'm Vince Caimano, and I'm joined by Rosemary Weaver, and we're pleased to have this opportunity to talk with you today about where we feel peer support is, where it's come from. We think we have a unique perspective to bring to you in that we've been working in this area for over 11 years now. And I don't mean just in the peer support area, I mean with regard to bringing peer support to people using technology and using some very, now, we think, state-of-the-art tools. So we have a lot to share with you today. Part of our presentation is going to be based on a survey that we just completed in the last week or two amongst peer supporters, getting their perspective on what has changed during this pandemic and where they think peer support is going. And we're also going to share from the work that our company does that has been a pioneering company with regard to doing virtual peer support. Let's see. So let me tell you a little bit about my personal journey. I come at this work as someone with lived experience and someone who's been fortunate to have an interesting combination of career experience in psychology, organizational psychology, and also in technology. So over my career, in addition to working as an organizational psychologist, I also had the opportunity to be what a lot of folks would call a CIO of a very large IT organization in the aerospace industry. I worked for some very large consulting firms, also doing a blend of people-oriented things and technology. And with that as a background and with my lived experience, starting 10 years ago, we launched our first platform for providing video-based peer support groups. So that was late 2009 that we introduced that. And more recently, we started last year, before the pandemic, before everyone was jumping on Zoom meetings, we started to work in earnest on our new platform called Hey Peers. We're going to tell you more about that, but it's a lot where we think that peer support will be in the future, and that's why we call this presentation "The Future is Here." We think that the work that we're doing and the peers that are working on our platform are doing the work that's going to carry on for quite a while now, that a lot of folks have been introduced to via the pandemic. I'm also happy to say that I'm serving on the board for the National Association of Peer Supporters, or N.A.P.S. as we're calling it now. And so I'm glad to also be partnering with Rosemary Weaver. I'll let Rosemary introduce herself here.
Hello, I'm Rosemary. It's a pleasure to be here. I'm a nationally certified peer support specialist. I was actually one of the first people to get that certification. I'm also a certified recovery peer specialist in the state of North Carolina. And because I got the national certification, which is done by the Florida Certification Board, that makes me certified in that state as well. I've been doing some ROSC consulting, which is recovery-oriented systems of care. I was trained by the Copeland Center to be a RAP facilitator, and I founded the very first drop-in center in the state of North Carolina in 2012. I started out with a DBSA chapter, and eventually that led to developing the drop-in center. I'm also a member of North Carolina Peer Support Work Group that is making recommendations about the peer support certification process, and I have lived experience both with mental health and physical health issues. I've worked in community mental health for about 7 years, and I've worked in an inpatient environment for 5 years. So I've got a lot of experience. And that's pretty much it.
So that's about us. Now we'd like to learn something about you. Shira is going to put a poll into the meeting, and these are the questions that we would like you to respond to. Tell us where you're from, and also we're curious about if you were involved in virtual or video-based peer support before the pandemic. Okay, and I think we have a good response now. So this is interesting. We know from our work helping people virtually that about half of the US population is in the Eastern time zone, and about 37% of you all say that you're there. We know that about a third of the US population is in the Central time zone, and we have about a third of you all from there. Out here in the West Coast, it's about 16% of the population, and then the balance is in the Mountain time zone. So we're skewed a little bit toward the West, which is fine with me. I'm talking to you from Pasadena, California, where we've had the unfortunate distinction of having, in addition to the pandemic, having really crazy hot temperatures a couple of weeks ago, 115 degrees here, where that was probably about 20 degrees hotter than usual that time of the year. And then the Bobcat fire, which you may have heard of, was burning about 5 miles from where I'm sitting. And then to add the icing to the cake, we had a little earthquake, kind of a medium level earthquake in the last week. So we've had all kinds of stuff going on. And so we're pleased to have others from the Pacific time zone joining us. The other thing that's notable is that 78% of you say that before the pandemic, you weren't involved in virtual support. And of course, that's changed tremendously, as you'll see in the poll results that we'll share with you. Okay. So this is what we hope that you'll get from this time with us. We hope that you'll understand a number of changes that have come about as a result of the pandemic. I think you'll be interested to see that while technology is one of the big changes, that there's some other changes that peer supporters reported that I think are very important as well. We'll talk about some of the different things that you can do from a technical and programmatic point of view that might be helpful going forward. And we'll also importantly discuss some of the competencies that have been facilitated, have been developed further because of the pandemic, and the peer supporters who responded to our poll tell us will probably be important in the future as well. And Rosemary?
These are the learning, you're going to change the slide? Yeah, thanks.
Yeah, I did. Whoops, let me go back. Okay, so we should be on the webinar agenda slide. Can you see that?
Yes.
Okay.
Oh, that's right there. Perfect. Thank you. So briefly, our webinar agenda is talking about the development of remote peer support, how COVID-19 has just kind of really launched it. And our survey, as Vince mentioned, we're going to talk about what the survey didn't say, and some competencies that peer supporters need now and will need tomorrow, the future, and Q&A. Go to the next slide.
Okay. So it's interesting for me to think about how long it took for us to actually have the technology that would enable really robust peer support, robust virtual peer support. That is, where we could actually have a video meeting that was something like a face-to-face meeting. And so if you think about this progression of peer support going back to the 30s, where there were some of the first peer support groups, you know, via AA, it took 75 years from that time to the time about 10 or 11 years ago that we started providing video-based peer support meetings. It took 75 years for that to develop. However, it only took, maybe a month or two for people to move from face-to-face meetings and face-to-face support all over the place to people jumping to doing things online in a big way because of the pandemic. So why is that? Well, we talked with a lot of organizations before the pandemic, because this is our business, to provide support to people providing peer support through the use of technology. And what folks typically said was that, well, they didn't have the budget for doing this, or they didn't have the skills for doing this, or they didn't have the technology for doing this, or they were concerned that the folks that they were serving wouldn't have the technology for connecting to those services. Or they were thinking about doing it, but it was in their long-range plan. They weren't going to do it right away. So there were a lot of folks that said, you know, yeah, that's kind of interesting, but not right now. We can't really jump into that. Of course, pandemic changed all of that, and people jumped in. The other interesting thing to note was, so we did build up a base of clients even before the pandemic. So a lot of organizations, we have organizations we've been working with for years, like the Depression and Bipolar Support Alliance. We provide their online peer support groups, which now serve a very large number of people weekly. They register about 650 people a week for their support groups. And part of the reason that we had some early adopters to providing virtual peer support is the research that we did. And the research that we did said that people who were participating in this was for depression, people participating in our depression support groups reported that there was a 34% reduction in their symptoms. People who said that they were moderate to severely depressed, over time, that was reduced by a third. They also told us that their use of emergency rooms and urgent care for issues related to their challenge with depression, that was reduced by about half. And they told us that their need to be hospitalized was reduced by 69%. And that last point was really significant in that you might know that there are 2 published studies about peer support and hospital readmissions, one of which says that it could reduce hospital readmissions by 70%. The other one says 72%. So this told us that you could provide peer support virtually and get about the same impact that you would if you were doing it face-to-face. So the other studies were done with people providing peer support face-to-face. And often that was one-on-one. And our services back then were largely providing groups. So people joining together in a meeting, something like what we're doing now, but of course smaller, where we'd all be talking together. And that worked very well in terms of helping folks on their behavioral health journey. So what's happened since the pandemic? We went from the end of last year, we had 39,000 subscribers to our services. And some of those services we provide directly to the public, but most of those services are provided by other organizations like by DBSA, I mentioned them, and there are a whole bunch of others that I could mention. So that's grown from 39,000 to 58,000 today, and we are currently hosting over 700 meetings a month on our 2 platforms. So for a long time, we provided services on a platform called Support Group Central. There's still a lot of activity there. And what we're moving toward is our new platform called N.A.P.S. So I'm going to show you a little bit more about that in a minute. And this last point about the future we think that's arrived, it's not just changing, we think, how peer support is being delivered, but it's actually changing the opportunity that's available to peer supporters. We are in N.A.P.S. creating what we call a community of peer support, and with a lot of different tools and a lot of different options for how people interact and how people provide services. And the one that I want to highlight for you now is about our independent peer supporters who provide services on this new platform that we started developing a couple of years ago that we released earlier this year called N.A.P.S. And we have over 30 certified peer supporters, certified peer specialists, certified recovery coaches, the person who has a certification. We have these folks on here. Rosemary is one of them. You see her over just slightly to the left of the center of your screen. And they have the opportunity now to offer services directly to the public. And here's a profile of one of our people. So Rosemary has a profile like this too. This fellow, Ted Thomas, has been working with us for a number of years. He is offering, you see that upcoming meeting list on the right side of your screen. So he's offering a number of different services. There's more information about him on the left. If if we could display this differently, we would scroll down and see more about TED. So we think that the future of peer support is not just with regard to, or the change in the future of peer support that has arrived. It's not just about how we deliver peer support, but it's also about you, if you're a peer supporter, the opportunities that you have, the things that you can do. And you don't have to do that alone. I know some people are figuring, well, if I get a Zoom account, I can provide virtual peer support. You know, I could just kind of jump into that. But as we're going to talk about in a little bit, it takes more than that. And one, we think, essential piece is being on a platform that offers a lot of different options, that's very flexible, that will allow you to do a lot of different things quite easily. Okay, so I'm going to turn this back to Rosemary, and we'll start to talk about the survey that we did.
These are the 6 areas that we asked about in the survey, which was sent out to peer supporters all over the country. So we wanted to know the impact on their employment, wanted to know how, you know, it was advantage to them, how it was a disadvantage, what kind of skills did they need to learn, and what's their lasting impact on peer support. Go to the next. These are a breakdown of the demographics, and I have to tell you a little story here real quick. This morning, when I was reviewing all these slides and what I was going to say, I realized that one of the bullet points, the percentages don't add up. So that just shows that math is not my strong suit. It's actually the one about the breakdown from various parts of the country. But we received 119 responses from 30 states. And one of the things I found really interesting was the age group, that 63% of the respondents were age 50 or over. And I fall in that age group, so all I can say is wisdom comes with age, and that makes us great peer supporters. We had a large amount of people who were female as well that responded. And the majority of respondents were either a certified peer specialist or a recovery coach.
I'm going to mention here that there's a study that you can find a link to. You can find a link to an executive summary of a study. It's on the, excuse me, it's on the N.A.P.S. website. A larger scale study that Boston University did covers some other topics, but it's interesting when you see the demographics for that study, they're similar to the responses that we had. And you'll also find some other parallels. So I would encourage you to go to the N.A.P.S. website and take a look at that study as well.
These are the major themes of the impact on peer supporters during the pandemic, those that completed the survey. So some people lost employment. Some people are working less hours. Some people are working more hours. There were job and career changes. Some people are working from home, full-time or part-time. You know, some are doing like a hybrid. Sort of, you go in the office 2 days a week, you work from home 3 days a week. They're not able to meet the people that they serve face-to-face. And schedules, positions, and duties have changed. Go to the next one.
So we also asked about, you know, how has your work changed, the way you do your work as a peer supporter since the pandemic? And what was interesting was the biggest change was that people were doing more work on the phone, which I guess makes sense because that's like the easiest, most ubiquitous kind of piece of technology that we all have. But the second largest was that people were now meeting with folks virtually using some kind of video-based way to connect with individuals. A lot of folks mentioned Zoom. The Zoom meetings are almost synonymous with the idea of having a video-based meeting of some sort. 42% of our respondents said that they were working from home. That was interesting to me because that says that a lot of folks were still going into their office to do this work, or going somewhere, I guess, where they had a good internet connection or had the technology they needed. Some folks said that they were using more chat and text-based ways to interact with people. And then smaller percentages mentioned that there was some new system that was put into place. I know Microsoft Teams was mentioned a few times in the survey results. And now only 12% specifically said that they were going to the office, but of course there's this gap in the data here that we can't explain in terms of people saying that they were working from home, 42%, only 12% specifically saying that they were going to the office. This was a question where we had some specific responses for people to choose, and then an open-ended question, an other kind of opportunity. So that might account for the fact that those two numbers don't add up to 100%. Only 4% of our respondents said that their work hadn't changed, or the way they did their work hadn't changed.
These were some of the work pluses that were mentioned in the area where people could just type in their response. In other words, open-ended questions. And as an independent contractor with Support Group Central and N.A.P.S, a lot of these have applied to me. So working from home is definitely considered a plus for most people because you have more time for your family. You get to sleep in. That was the one I liked the best, make your own schedule. You also get the opportunity to learn new skills. If a person has not been doing online types of things, they get to learn about the technology. A lot of people felt that everyone's hygiene and sanitizing improved because of COVID. There's also the ability to teach clients new skills, get very creative with that. And there's new opportunities for professional growth. For myself, I found that there are courses online that I can get certified in certain things because of COVID that were not previously available to me. Other pluses were helping the people served to become more self-sufficient and resilient, learning new ways of engaging clients because it can really be a challenge to do that. And some people said getting to work in their pajamas. People working in healthcare, particularly in inpatient settings, got hazard pay. And a lot of people mentioned they're no longer being used out of their scope of practice. It's unfortunate that many peer supporters are given duties that are not related to peer support. They become, somewhat of a gopher sometimes. And that's not, happening with it being done virtual. And the last thing is working with clients all over the country. Now, in my case, I can say on Support Group Central and N.A.P.S that I've worked with people all over the world. I've had people attend my meetings that are from Europe, Asia, Africa, Australia. And it's just the coolest thing ever. I just love that.
Yeah, I want to mention too that our peer supporters are all over the world. We have one fellow that works with us in the UK. We have a woman who's in Belize. Most of the peer supporters that work with us, I haven't had the opportunity to meet face-to-face. Occasionally, I meet one at a conference. So Rosemary, who's worked with us for several years, I finally got to meet her last year. at the N.A.P.S. Conference. But it's really a very different way to work. It's not like going into the office and being with the same folks every day. So here we go. Rosemary has the next slide.
There were, of course, some minuses. A lot of people felt an increase in depression, anxiety, isolation for both themselves and the people that they serve. I can tell you for myself, I always thought it would be so cool to work from home, you know, make my own hours, sleep in. And I found that I was actually surprised that the isolation was difficult for me. People miss the in-person interactions with clients and coworkers. And working with technology can sometimes be more restrictive or create problems. Maybe you've got internet issues, you don't know how to use the technology. Zoom, for example, is constantly doing updates. So you log on for a meeting and, oh, wait, that got changed. Holding in-person groups while social distancing is definitely a challenge. Limited PPE, that's personal protective equipment, and sanitizer. More overdoses in the emergency room. And that one really bothers me. To think that we have people that are overdosing and perhaps dying because of this, maybe because of lack of services. There's also lack of access to office equipment, lack of supervision, and lack of communication with coworkers. I can tell you for myself, what I have done is I've reached out to the other facilitators on Support Group Central and N.A.P.S to make more of a personal connection with them. Some of us do our private meetings just to get to know each other and to support each other on both Zoom and N.A.P.S. And it's really been great. I've learned a lot about them, and it's helped me a lot with my own support, being able to do that. You can go to the next one.
Yeah, I think that you should be able to hear me, but I'm worried that this is frozen up. I'm going to, okay, there we go. So, Rosemary, can you see the COVID-driven skills slide?
No.
Okay. Let's see. How about now? Can you see it?
No. There it is.
Okay, great. So, so we asked, you know, as a result of the pandemic, what new skills have you had to acquire? Well, the largest number of responses to this question were about video skills, you know, learning how to use Zoom, telehealth type skills, computer technology stuff. So, you know, that's probably what you would expect, because we suddenly went from face-to-face meetings to, you know, everybody jumping on Zoom in large measure. But what was interesting here was that a number of people, 18% of the responses, were around having to sharpen my interpersonal skills. It was almost like peer supporters suddenly didn't have to do a lot of the things that maybe were not as central to the notion of peer support. They had to really focus on more clients who were hurting more and struggling more. You know, I'm sure you've heard the statistics that the rate of behavioral health issues has climbed, unfortunately, to a very high level because of the pandemic. And so peer supporters were challenged to deliver peer support at kind of a higher level. And so a lot of folks said, you know, I really had to work at this. And it was an opportunity for personal and career growth. And the other kind of dimension of that was that they had to be taking better care of themselves to deal with all of this. and organizations had to be more thoughtful about how to provide peer support for peer supporters. You know, Rosemary just mentioned some of the things that she did, and we actually have had this as a practice for a number of years now with regard to the peer supporters that we work with. We have a licensed clinician who is a peer and who has provided virtual peer support. So interesting person in terms of her background and so forth. She runs support groups for the peer supporters that work with us. And they have an opportunity to get together and to support and encourage each other, and also to share notes. So I'll talk a little bit more about this later, but the whole notion of the peer support job as it's evolving means that support for peer supporters needs to evolve as well. So hopefully you can see the new slide, which is, can you see that, Rosemary? Yeah, okay, good. So I think my connection slowed down a little bit there for a while. But so then we asked the folks responding to the survey, well, what did you think was going to be the lasting impact? What was going to come out of this experience with the pandemic that would not change? And a very large percentage of people said, you know what, we're going to keep doing things virtually. We're going to do that in combination with providing services face-to-face. And having both of those is going to expand our ability to reach more people more quickly, and to just be more effective in terms of the peer support services that we offer. We also heard from our survey respondents that they felt there was going to be a higher level of appreciation for peer support because they had the opportunity to reach more people. So more people would be aware of this as a tool in their journey and something that they can rely on, and that would be helpful. And of course, folks said, you know what, there's going to be less face-to-face. We're going to have to do that more carefully anyway. So, you know, the combination of technology and doing things virtually is going to kind of counterbalance the fact that we probably will do less face-to-face and have to do that in a more prescribed way. Okay, Rosemary?
So this is what the survey didn't say. Although we got a lot of information, there were some things that were not clear. The first bullet point, how to create effective, engaging, and helpful virtual services. And although some of this was listed in the plus side in the survey, it really didn't tell us whether or not training was provided. So we don't know if peers had to learn on their own, or did agencies provide training. We also did not learn from the survey how to measure the impact of peer support. As Vince mentioned earlier, typically a way that we measure the impact of peer support services is a reduction in the use of more costly services, like the emergency room or maybe ACT services. But now that would not necessarily be an accurate way to measure it, because people are not using the emergency room right now, perhaps because they're afraid of COVID-19. And also some of the services that were available in the community before are no longer available, or there've been a reduction in services. Another thing that the survey did not tell us is how peer supporters are getting support with their own issues. I've told you previously about how I've been doing it, but we really don't know what everyone else is doing, and I think it's important to encourage everyone to reach out for support. Now, expanded peer support job technical requirements. We don't know if having to learn new things technology-wise, if that equated to an increase in pay for peer supporters. And lastly, the opportunity for entrepreneurship. And for me, the Hey Peers has been great. I have the ability to schedule my own meetings. I can offer things that previously I was unable to offer. I'm able to connect more closely with the people that come to my groups because we have a chat feature. It gives me the ability to use my marketing skills. And it has definitely boosted my income. So I find it really, really exciting that Vince has allowed us to be part of this, sort of be on the ground floor. And there's a lot of ways that peer supporters can start their own business, not just on Hey Peers, but in other ways as well. So you can go to the next slide. Oh, there we go. So lastly, we're going to talk about some of the competencies needed now and tomorrow. Now people need computer skills, video meeting skills, peer support and technology, supervision, and online etiquette. So we don't know if people that responded to the survey or any peer supporters out there are receiving supervision for just their peer support services, or are they receiving it for technology? And of course, online etiquette, we've mentioned before, not doing meetings in your pajamas, making sure you take care of your hygiene, remembering to comb your hair and checking your lighting. And these are all, how to use the chat feature appropriately. Those are all important skills that people need to learn now. But for the future, the criminal justice system and forensic peer support are really kind of on the forefront of the future. Right now, the courts are doing, in a lot of states, their court hearings virtually. And many of them are looking at ways to be able to continue doing that in the future, even after the pandemic is over. And this, of course, also opens more opportunities for forensic peer support, because people that are incarcerated, as well as those on reentry. And those are some competencies that a lot of states don't have, like a certification for forensic. So that would be something for the future. And of course, entrepreneurial and marketing skills, as I mentioned, how exciting that was for me to do. But it's not something that people typically know, whether you're doing peer support or anything else. To being able to start a business, create a business plan, how to even do your taxes, and marketing skills. It's also providing more opportunity through the pandemic for people to go back to work, or to work for the first time that may be receiving Social Security benefits. Because remote work could be more possible for someone, where before maybe they didn't have transportation to get to and from a job. It's also important for people to understand how the working actually affects their benefits, not just their Social Security, but food stamps and other types of public assistance. Integrated health is another thing that's needed in the future. Although some places are doing integrated health, there's not been a whole lot of training out there for peer specialists. I'm not aware personally of any state that has a certification for integrated healthcare. So that would definitely be something to consider for the future. And then there's the duty to warn. For those of you that are familiar with working in the clinical world, you know that if someone expresses a desire to hurt themselves or others, that as the service provider, you're required to report that. But when you're working online, how does that apply? It makes things, you know, a little different, because you may not even know where that person is located. They could be anywhere in the United States or on, you know, even in other parts of the world, and you don't have contact information for them, perhaps. So I thought that was important to mention as well. And go to the next one. Vince, you're muted.
To summarize some of the things we've touched on, and maybe to emphasize some things that we see, you've told us through the survey that we've done, or peer supporters have told us, and we certainly believe this to be true, and we've seen it now for a long time in the organizations we work with, that while face-to-face services will continue and be very important ongoing, virtual services are here to stay and will complement the face-to-face services. And virtual, of course, will allow a whole bunch of new things so that more people can be helped. And the second point there on the right, they can be helped more immediately. There are still agencies, that some of you may be working for them, where you know, clients need to come in during normal business hours, Monday to Friday, and on a platform like N.A.P.S, we are building a bot to help direct people to services that are being more immediately available by having a great community of peer supporters doing a variety of things. There are more ways for people to attach themselves to peer support. So having a great mixture of really robust services and technology, we think is where things are at today and will be for the future. Of course, that's going to require that peer supporters have some more sophisticated peer support skills with this expanded notion of being a peer supporter that blends in the technology skills along with the interpersonal skills and the knowledge base that peer supporters have. It's a higher standard for performance, where people are required really to do a lot more juggling. I know from working with people like Rosemary and Ted Thomas that I showed you his profile for later, I know that they're really successful at this, and they're successful because they're able to keep a whole bunch of plates spinning at the same time, and paying attention to what's going on with the people that they aspire to serve. So Zoom is a great platform for doing video meetings, and it even has some additional functionality that they've been adding to help people to kind of organize participants. So we think that Zoom is terrific, but we think that for the future, for now and going forward, it's not enough. To have a more integrated platform where people can connect using video, using chat, allowing people to track their symptoms, their mood, do journal entries, having all of that in one place, where there are also organizations offering services that they may be familiar with, may be comfortable with. Having all of that in one place, we think, is what is needed going forward. The other thing about doing work virtually is that we have to pay more attention to things like HIPAA and Section 508. So if you're not familiar, most people are familiar with HIPAA. If you're not familiar with Section 508, this is making a website ADA compliant, so people with hearing or visual limitations can access the information on your website. So this is yet another thing that we pay a lot of attention to, have for a long time, and we know that that's part of what needs to be the case in the future for everyone delivering peer support virtually. Yet another thing is around, if you're working virtually, how do you know that you're serving the people that you're supposed to be serving, you know, that are in your mission? And so your technology needs to enable you to focus your services to the people that you are supposed to be helping. And in both of our platforms, we've built in a bunch of functionality that allows that to happen. So for example, if you have services that are just for women, or you have services that are just for a particular state, or you want to screen individuals that you allow to participate in your services, these are all tools that we provide and can be really important as opposed to just putting a link to a Zoom meeting out there. This requires that peer supporters be more flexible, be more versatile. It gives them an opportunity to develop their skills and have a more satisfying career, and to do more things, and to avoid doing some of the things that I've heard peers get relegated to in some situations, where they're driving people around and doing things that may involve peer support but may not involve peer support in a way that you may like to think of yourself as doing that. So we mentioned briefly about how to measure the effectiveness of peer support. And so a lot of the focus in a lot of organizations is you and clinicians assessing the people that you work with. When you move to a virtual environment, that kind of gets flipped around in terms of the people you're serving assessing you and providing feedback. And we have a whole bunch of mechanisms for making that happen, so that you as a peer supporter know what you're doing well and know where you may want to build your skills. It's also the case that the individual being served, they can track their own outcomes, and you could look at what they are experiencing as a way to assess how things are going, as opposed to making kind of a third-party assessment of that, which may or may not kind of fully represent what that individual that you're helping is actually experiencing. And last but not least, we hope that where we are today with this marvelous blend of peer support and technology, providing more services to more people, reaching more people, that means that whatever your mission is, that you will be able to fulfill that, that it won't be just kind of grinding away on a day-to-day basis trying to make something happen, that in fact you will have a tremendous impact, and that you and your organization will prosper. So we think that the future of peer support is very bright, and we're happy to be part of that. And we're particularly pleased to have had this opportunity to meet with you today. I want to offer up these links for additional information if something that we've mentioned is of interest to you. Here are some links where you can get more information. And we're going to turn it over to Shira now, who will monitor the chat. And if you have questions for me and Rosemary, please go ahead and put those questions in the chat, and we'll try and answer as many as we can.
Thank you so much, Vince and Rosemary. That was an amazing presentation, and yeah, this is all just really great information. So the possibilities for the future of peer support are super exciting. So yeah, please feel free to go ahead and ask questions in the chat. We do have some questions about whether you'll receive a copy of the PowerPoint. And I did want to let you know that, yeah, that will be on the N.A.P.S website. After this, if you go to past webinars, you'll get to see the link to the recording and the PowerPoint that should be up within a couple days from now. We have our first question. How can we engage new clients in this virtual world?
Yeah, so I'll take a stab at that in general, and I think that Rosemary probably has some good experience that she could add to that. So I think that engaging folks starts with building a relationship. And so on N.A.P.S, we have the opportunity for people to enter different chat rooms that are moderated by our peer specialists that are on N.A.P.S. And so you get to know people a little bit, what some of their issues are, and then you might be able to direct them to an opportunity to interact with you further or with other people in a group meeting. Rosemary, how would you respond to that question?
Well, I would echo what you just said, first of all, but also that relationship establishing is really important. People can join Zoom meetings and N.A.P.S meetings anonymously. They don't have to have their cameras on. They can change their name. So sometimes it can be difficult to engage people. What I often do is acknowledge maybe that they have some discomfort with the technology, ask if they need any assistance with it, and use a lot of my own personal experience to help facilitate discussion and engagement.
And the other thing that we haven't talked a lot about today is how do you put together an effective video-based support group? And we have, over the years, we've developed an approach that we think does really engage participants. And it's similar to what you would do when you're in a face-to-face meeting. So it's really important to think about the design, the meeting process that's designed into your support group. Just to throw a bunch of people together and start talking is not going to be, in our experience, not going to be as effective as thinking about how to help people to become comfortable on a gradual basis, get to know each other a little bit, even though each meeting may not have exactly the same people in it. You want to make sure people get comfortable. You have some meeting guidelines. And you have a meeting process because that's clear, because a lot of folks, of course, that we're working with today have a lot of anxiety. And so trying to bring that anxiety down so that they can interact with each other and hear each other and encourage each other, we think that that's essential. So we have a lot of experience putting together meetings that we usually use PowerPoints to structure our meetings. So everybody kind of knows where we are in the meeting process. They know what to expect. And we use that structure to really engage folks.
Yeah, the fact that it's consistent, I think, is really important.
Yeah.
Thank you. Another question we have is, if I bill Medicaid, I can virtually get clients' consent due to COVID. In the future, how do I get consent to provide support services?
So what we do with our platforms, and I'm sure that there, on other systems, there could be a way to do this, but as a person registers for, either creates an account to work with a particular organization, or they register for a meeting, we have the opportunity to put into that workflow any kind of survey or agreement, terms and conditions, so we can get a person to sign off on something before the services are delivered. And I think that would probably meet the requirement that's being asked about with regard to Medicaid.
Thank you. Someone is wondering if anyone has used a YouTube format for delivery of support.
I have not, but that's an interesting idea.
The thing that, yeah, we like to think that we want to try out a whole bunch of things, and there are more and more options that are available. The thing I would encourage you all to be cautious about, and this was said in a really great documentary called The Social Dilemma that I would recommend to you. It's on Netflix. And at one point, one of the people in this documentary says, if you're not paying for the product, you are the product. So you have to be careful where if you use free social media kind of based services, that you have to be careful because they're collecting information about you and they're going to market to you. And so I don't know exactly what kind of service you might find on YouTube, but that would be my one caution. Sometimes it's better to use a platform where, so for example, on our platforms, we have never ever sold the information that we collect, just a little information that we collect about our participants. We don't have any advertisements. We don't sell our information to marketers or anything like that. So you want to be working with something that's going to be in that realm, and be careful of the commercial products that are really there to try to sell you stuff.
Thank you. Yeah, that's really important and helpful. We're getting a lot of positive feedback, by the way. Everyone really enjoyed the presentation.
Thank you.
This question asks, the survey results were interesting and Hey Peers is an intriguing platform. Traditional peer support services often occur in settings alongside other clinical services like therapy with clinical oversight and supervision from mental health professionals. How does Hey Peers address or encourage this?
Yeah, so we have a variety of ways to deploy Hey Peers for an organization so that it can be integrated with other services. And we have some specific services that are not they're not visible if you go to Hey Peers. It's something we can talk to you about, but we actually have some tools that clinicians could use to work with their clients that are using Hey Peers. So if you follow up with us on the second bullet here, the organizational service inquiry, and say, you're interested in learning more about that, we'll be happy to follow up with you and give you more of the details.
And also the clinical supervision question was part of that. And we do receive clinical supervision from the licensed clinician that Vince mentioned earlier that does the groups for all the facilitators.
Thank you. Our next question asks, some populations that are already hard to reach have become even more so because of an income and technology gap. Do you have any resources to recommend to clients who lack the technology for virtual support?
Yeah, some of the organizations that we work with, as they seek funding, they get funding for devices and providing usually cellular-based data services. And what we know is that if you buy those things in bulk, the cost can go way down. So you can provide a device at a very low cost with data services for your clients. It is an additional cost. That's kind of the more challenging part of my response here, but I think the more encouraging part is that more and more people at every socioeconomic level have a smartphone, and they can usually find a way to access virtual services on their smartphone. and yeah, with COVID, it's definitely more complicated now, because you used to be able to say, well, you can go to a library, or there are other places you can go and hang out and get free Wi-Fi. But now I would look more toward, and it would require funding, but you can get devices and services that you can provide to people if you can get the funding for it.
Well, Vince, there may be possible funding due to COVID-19. There's been a lot of funding from the federal government for people who provide healthcare services. And I know in North Carolina, for example, some of the managed care organizations are providing cell phones for their clients that they serve.
Thanks so much. Our next question is asking about older clients or those who are not tech savvy.
I'm sure I didn't quite understand that. They're asking about what plans?
Older clients or those who aren't tech savvy.
Okay.
Anything you do for those clients?
So we actually, in the last month or two, we've been implementing services for one client that are directed at seniors. And so number one, a lot of the people using our services are middle-aged and older. But this new service is directed at seniors. What we know about that is you just want to be more careful about how you communicate how to use the service. So you want to have step-by-step instructions that are very clear. If you can provide a visual aid along with a description, if you can provide short videos that show exactly how you register for a meeting, how you join a meeting, what a meeting is going to be like, so that it's not a surprise, that can be really helpful. You have to couple that, of course, with customer support or technical support, which goes beyond just answering general questions. You may have to do some troubleshooting with someone and say, well, what kind of device are you on? What browser are you using? Have you tried this? So we try to provide a variety of support services, and then in working with the organizations we work with, we advise them, and then they have to turn that into again, really clear instructions for their older users. And Rosemary, you have anything to add about that?
No, I don't. There was a comment in the chat that I saw that I wasn't sure if it was going to be brought up as a question, but I did want to address it. Somebody said they were interested in becoming a peer supporter on N.A.P.S. And the top link there says become an independent peer supporter. You click on that, it will take you to the webpage where you can do that. I just wanted to add that in order to be a peer supporter on N.A.P.S, you need to have a peer support certification from whatever state you live in.
Yeah, and if you are in a state, there are only a few of them. I'm so embarrassed to say California is one of them, but
I think it's the only one.
If you're in a state where there's not a certification per se, we want evidence of your successful completion of training. And but our preference, obviously that'll be okay for California, and I think there are a few other states that don't yet have their certification system set up. So that's what you'll need to do. And that link, what you can't see in the link is that where it says become peer supporter, there are underscores between become peer and supporter. So if you're writing this down or typing it into a new tab on your browser or something, you'll need those underscores between those words for that to work for you.
Thanks so much. That's really helpful info. We have another question asking if you found any apps to be helpful.
So we do have a Apple or iOS version of N.A.P.S that's available in the Apple store. And we're working on an Android version of N.A.P.S. There are a lot of other apps out there, and I'm trying to think. I really, while we monitor what's going on with regard to apps, I don't have one in particular that I could recommend to you. Maybe Rosemary, do you have any that come to mind for you? Maybe if I think more, I'll remember some.
So you're asking about an app to provide peer support services with, or an app that would provide some support to people independently?
I'm not seeing any further comments. I think if you want to let us know. Oh, app for add-on support.
Okay, that I can address that one for sure. There's a number of apps out there. It's astounding how many were out there previously to COVID and are out there now. For anyone that's familiar with Wellness Recovery Action Planning, otherwise known as WRAP, there is a WRAP app. There are other apps out there that help people with meditation. I think Insight Timer is a really good one. Okay, so and I see people putting some things in the chat as well.
Good.
If you go to the App Store on your phone, whether you've got an iPhone or an Android, and put something in there, what you're looking for, then a bunch of them will come up.
Thank you.
Yeah, actually, someone mentioned Calm. I'm a real fan of Calm. It's been around for a long time. They have a lot of really great meditations and programs that you can use. Yeah.
Thank you. Our next question is asking about overcoming difficulty in this new world for clients who are used to face-to-face service.
I didn't quite get the beginning of the question, Shira. I'm sorry.
Yeah, it's asking about overcoming difficulty engaging with clients who are used to face-to-face service.
Yeah. I think that this is where having a combination of face-to-face and virtual, I think is going to be really important. So while we are, obviously we're enthusiastic about providing services virtually, that's kind of our thing. I know for me, I believe that face-to-face is got to continue, and we need to do the best we can with it. I know that's very challenging right now, but I would hope that for people who are uncomfortable about the virtual, that they will be encouraged through the face-to-face, that they might be able to sit down with someone might be able to show them on a device, you know, how you connect to a particular virtual service, how you use a particular app that might be helpful to them. There's a professor at Dartmouth College, Karen Fortuna, who does work on digital peer support, and she has offered some training for peer supporters, and I believe that in part is about how to, you know, bring digital tools into that space where you're working with somebody and helping them. So I would encourage you to take a look there. Rosemary, you have other ideas about this?
I do. I can tell you what I personally do, because there's a lot of people that have joined our meetings on both N.A.P.S and Support Group Central who have never done virtual. And one of the things that I do is to sort of humanize it with myself. For example, some of you probably saw a tail walk by me earlier. That was my cat. she is my emotional support animal. And I have anxiety sometimes when I do things like this, and she senses it and comes up and sits on my lap. But sometimes she wants to, get up and see the people. So that is a human part that gets thrown into that because people realize, how the anxiety affects me, what I do about it. Stimulates conversation, sort of helps put people at ease. You can start talking about your pets. And she does that on a pretty regular basis. And most of the groups that I do, people just love it. So there's other ways you can personalize it. For example, people that say, well, I don't want to turn my camera on because my house is messy. I've actually taken my laptop around my house in some of my very messy rooms, because I'm a clutter person, and showed them what mine looked like. And eventually, most people do open up.
Thank you so much. That's awesome. We have someone asking if there's an estimated timeline for Android compatibility for Hey Peers.
Yeah, so what I should say about that is Hey Peers will work within a Chrome browser on an Android device. So you can do that right now. The timeline for the separate Android app is about 3 months from now, so it's still a ways out in the future. We are, I kind of mentioned in passing earlier, we're continually upgrading and improving Hey Peers. So we have multiple technical development streams going, and I kind of want it all right now, but it's going to take a while longer to get all of the things done that we would like to have there, so that we have that really great community and variety of resources. So yeah, 2 or 3 months.
I would like to see it all done now too, Vince. I can tell you that I've had to use my Android phone for Hey Peers because I had technical difficulties on my laptop, and it works very well.
Yeah.
Thank you. Yeah, that's exciting. And then we have someone asking about lower cost internet services for seniors. Would you know any resources around that?
I can answer that, and maybe Vince, you want to add to it. AT&T offers some things, and depending on what state you live in, I know people in North Carolina, for example, that are getting their internet for $10 because they have a disability, or they're getting Social Security benefits, or just low income. And senior centers would be another place that I would certainly explore. What are your thoughts, Vince?
That you came up with better ideas than I would. Those are great.
Great. I think that's about all of our questions. I'm not seeing any more questions. If you want to ask, please go ahead. Please feel free to do that in the chat. But I just want to thank everyone for joining us today, and thank you so much, Vince and Rosemary. And the PowerPoint and recording will be posted on the N.A.P.S website. Again, you can just go to past webinars. And then if you are a member, you can receive a certificate for this webinar. So just feel free to email us at membership@inaps.org, and we'll send you the quiz and your certificate once you've completed the quiz. And we really appreciate you joining us, and hope you have a great rest of your day.
Thank you to all of you for having us.
Thank you all for joining us today.
It's been a great experience.
Bye, everyone.